we can make ourselves healthier. We can make ourselves resistant to cancer. We can do a lot of things that are just now starting to be seen by the general public. And it's something I learned over the last couple of years.
Welcome to another Utah Business Spotlight. I'm your host, Peter Anthony. I'm super excited today because we're breaking out of the Utah box. We're taking you all the way to Daytona Beach, Florida, to meet Dr. Harry Black from the Sunrise Institute. He's the founder. He's making big waves in cancer resistance programs that are changing the way people see cancer, their options, preventative, as well as people who are there being coached through the process if they happen to have cancer. Man, Harry is amazing. I've known him for 15 years. One of my favorite men in the world. Super accomplished doctor. First, hit like, hit subscribe. You guys share this with people because people want to know what's going on. This is the best way to highlight your business. Welcome, Harry.
Thank you, Peter Anthony. Glad to be here.
I'm super excited to have you today.
Me too.
The Sunrise Institute is just blowing up. It's doing so many good things. I know you've got a new book coming out in about 30 to 45 days that I can't wait to sink my teeth into. I've seen your program. You have a 6-month program. You have a 90-day program. You have one-on-one consulting. What you're doing in business and how your business is healing people. Tell us quickly, give me a little bit of your background, and then we'll get into who do you love to work with and what problems are you solving.
Well, my business has started because I developed prostate cancer 4 years ago. And the book you were talking about is going to be published, Cutting Through Prostate Cancer, A Surgeon's View from Both Sides of the Knife. I've been a general surgeon for 36 years, and when I developed cancer, the prostate, I have gone down the rabbit hole of allopathic medicine, which didn't lead me to ultimate healing. And so I got to the point where I wanted to explore a lot of different things in integrative or functional medicine. And that's where the Sunrise Institute started. And what I've learned is that we can make ourselves healthier. We can make ourselves resistant to cancer. We can do a lot of things that are just now starting to be seen by the general public. And it's something I learned over the last couple of years.
And from a marketing perspective, the idea of resisting cancer is really interesting because you want to resist that which is trying to dominate.
That's right.
Especially if you're not wanting it to dominate you. Cancer becomes the dominating force in your life, and you're saying, let's resist it. If we do these things, each one of them creates a component of resistance towards that which is trying to dominate you.
That's right.
Towards that which is trying to control you. Towards that which is trying to steal life from you. So I know that it's important how we use words. And I love that you're building something that's unique to you, which is cancer resistance programs that people can work with you. They can work with you remotely. Yes. They can work with you in Daytona Beach at your offices with your team. So it's really quite overwhelming even thinking about cancer. I have 4 friends right now who are very young, in their 40s and 50s, who've been diagnosed with cancer. We're seeing it more and more.
It's more common, especially in the younger age groups now.
Yeah, and it's one of those things that we have to resist. So share with me, what's the one thing that you wish people knew about Sunrise Institute that they generally don't? People who have cancer find you because they're in that spot where they have to find you. And I know that's
right.
I've turned my friends on to you. They love working with you. It's been awesome. I can see the shift immediately in their energy because they're working with you, and I want to say an infused sense of hope.
That's the goal, is to infuse hope into that situation, because so many people, when they get a cancer diagnosis, just almost give up. They don't know what to do, and it's a ton of information that comes at you. And I learned that myself just being a cancer patient, never having been a cancer patient before. I've taken care of a lot of people with cancer, but not been on the other side of it. So when I did that, it was like I talked to my friends and colleagues, the oncologists, with me as the patient, and the ton of information that's out there is just overwhelming. It's really confusing. And that was for me as a physician, let alone as somebody who has no medical background.
Sure. So one of the things that you share and you lead with is that you become part of the team, the cancer treatment team, and I then get to, let's say I'm the patient. I now have the opportunity to speak to a trusted advisor more candidly than my doctor might speak to me, because my doctor is bound by insurance things. He's going to say, well, there's no hope. You have a 96% chance of dying, because he or she has to be clear with me about what their role is. But now I can speak to you, who's not the actual physician, but the physician. You become my trusted advisor.
I think that's a good way of putting it, being a trusted advisor in a cancer treatment situation like that. I don't want to become the physician. In fact, the way Sunrise is set up, I'm not going to be the primary physician for anybody having a diagnosis of cancer. However, what I can do is add this integrative approach. Integrative oncology, meaning you're integrating things outside of normal allopathic medicine with chemotherapy, radiation therapy, hormone therapy, immunotherapy now, which is making a really big difference. But this is outside of all that, because if we address the underlying disease processes, whether it's cancer or high blood pressure, diabetes, anything in that chronic disease framework, we can make a big difference as far as what we're doing to treat somebody to get them better overall, to get their immune system healthier, to get their underlying cellular processes healthier. And I believe that integrative approach to oncology is going to be really beneficial going downstream.
And the Cancer Resistance Program, which I love the name, the Cancer Resistance Program, it really speaks to two types of people. It speaks to the person who might, at this moment, be experiencing a diagnosis, right? Mm-hmm. You can have cancer but not be diagnosed, right? So it's only it speaks to the person experiencing the diagnosis, but it simultaneously speaks to the person who'd rather not be diagnosed. So that it's the same. You're looking at that human being to set up the foundation of the human body to resist all the ways that cancer can come at you through multiple methods.
That's right. That's exactly right. Cancer, what I found out, I didn't realize this until about 2 years ago, and my diagnosis was 4 years ago, is that over 90% of all cancers are metabolic, not genetic. Now, when I say metabolic, that means there's a metabolic disease process, meaning that our energy sources, our mitochondria, are disrupted. However, we can address that by these overall means of getting healthier, whether it's exercise or nutrition or supplements. There's a whole lot of things that we can do to get ourselves healthier and therefore resist cancer and resist chronic diseases of all kind. And that's where I'm really going with this, is helping people understand that they can become resistant to chronic disease.
And resistance, done properly, leads to longevity,
yes,
which is the next step of the Institute.
That's exactly right.
Do I have that right? So
it's perfect.
Resistance will lead to longevity. And you take there's a bundle, a plethora of information that's being thrown at us consistently. And what I love when I watch your marketing and your message to market is that you are taking all of these things and you're sifting through it to bring us what's good for our situation, the way we live, for our lifestyle. Because I know that you're a proponent of a non-meat driven diet for some people, but for other people that you are a proponent and say maybe this is actually good. This bringing in that anti-inflammatory beef only sort of diet for limited periods of time.
The diet is really there's enough information out there on all sides of what diet you should eat that it gets very confusing for everybody, and there's science on all sides of it. And I think that really has to be individualized if you're looking to decrease the chance of any chronic disease or heal a chronic disease. And it's been a fascinating ride. And you're right, Peter Anthony, there's so much information out there as far as supplements, nutrition, exercise. There's so much information everywhere that it does get very confusing, and wading through that is what I've been doing for the last 2 years.
Right. And wading through it with, having seen over 75,000 patients, 15,000 surgeries, 2,000 cancer-related patients. You have an incredible abundance of experience. And one of the things for when we look at how are you positioning a company or a message, what I see is there's this abundant use of AI in the marketplace. And it's really interesting because it can bring a lot of information. It can sift through a lot of information, bring you a lot of information. But AI has never had cancer.
Right.
AI doesn't know. AI has never lost a loved one. AI is never going to have to separate from a spouse. AI has never watched someone in decline. It can only extrapolate experiences of others who might have documented those experiences, but it can't determine or understand those experiences. Where I would be highly inclined to work with you would be because I not only believe in your expertise, but I also now understand by reading your book or seeing some of your videos that you understand me. And the number one thing in marketing is when I believe that you believe what I believe, then we're connected. I'll say it again. When I, the consumer, believe that you, the service provider or solution provider, believe what I believe, when I think and feel that we share the same values, ideals, and are looking towards the same outcome, I then am connected to you. And now I will follow you. And that's the most important thing in marketing. You're doing that naturally, so well done.
Well, thank you.
Well done.
After being a surgeon for 36 years, the interpersonal connection is the most important thing. Just like you said, it's the most important thing in a relationship between a doctor and a patient. And AI is not going to have an impact on that. I think AI can be efficient in some things, but having that interpersonal relationship with somebody between two people, one with some expertise, the other in need of that expertise, I think it is just tremendously beneficial.
It's tremendously beneficial. And your program, your 6-month program for cancer resistance is just incredible because it takes you month by month, everything from testing and determining where you're at, where you want to be,
Yes.
The language that you're using to express to yourself the direction of your outcome, your personal treatment, but your personal goals and desires. It's quite incredible. Share with me, who is the best person that you're seeing come to you and make that decision to work with you? Because you're not very expensive in the scheme of losing your life, in the scheme of how much the actual surgery is or chemotherapy. You're pennies on the dollar
Compared to all that.
Compared to when you implement all of that. How do people, what's the best way for people to find you? Is it, I would imagine, Harry, that there's a lot of referral going on.
There are interpersonal referrals. I mean, people who know me, people who know me, and things like that. The person I think who's going to benefit the most by any of these programs, whether it's somebody with cancer or somebody who is interested in preventing cancer, is someone who's willing to commit to the whole process, which means number one, learning as we go. I have to learn about the patient, and they have to learn about me. And then the expectations are that the person is going to become deeply involved in promoting their own health. I had to do that myself. When I first understood that I had become unhealthy by being diagnosed with type 2 diabetes, I learned over a period of 2 or 3 years how to reverse that. Most doctors don't tell you that you can reverse type 2 diabetes, but I learned how to do that. And that served me as I got into the cancer
That created
realm.
the foundation.
The initial foundation, although I didn't appreciate it as a foundation at the time, because I didn't extrapolate having type 2 diabetes into developing cancer. That was still an understanding that I did not have yet. Now I understand that the whole disease process is tied up, whether it's high blood pressure, diabetes, chronic pain, a whole lot of things are tied up into that process of disease that can end up in cancer. So somebody has to be dedicated to doing whatever is necessary to prevent that.
Sure. When we had our salons, we would work with at the time in the 1990s, West Islip, New York, had one of the highest rates of breast cancer in the country. And having a series of salons, hair salons out there, many of my clients or clients of the salon would have breast cancer. And there were two components. I want you to weigh in on this. Everybody that we worked with, we had a little pro bono back end where we would work with them before chemo, right? And chemo was very aggressive in the 90s and
Still
80s.
is.
Still is, but it was much, it was like crazy aggressive, right? And there were two things that I extrapolated from my time with Tony Robbins and neuro-linguistic programming is our self-talk. Do you see that the people who come to you have to believe they deserve to live?
Absolutely.
And not bring their feelings of regret forward and say, this is happening for a reason. It's like they have to want to, I would imagine, and what I've experienced and helped people through is you have to see yourself alive, you have to build a compelling future, and you have to fight for it.
That visualization is really important. The visualization of having a diagnosis or almost having a diagnosis and visualizing yourself getting well from all that. That's absolutely one of the most important things that an individual can do is to start seeing themselves as healthy. And I think most people just don't think about their health in the way the country is now. It's starting to change a little bit, and we're seeing more and more people who are interested in changing things. And that's why medicine itself is changing. I think hopefully 10 or 15 years from now, the allopathic road of just giving out medications to treat the symptoms of whatever disease process rather than getting to the root cause is going to continue to evolve. And I think this new alignment of medicine is really exciting.
I think so too. And I've heard you say that if you're looking to move forward, you have to reclaim your health one breath at a time. I love that quote from you, reclaiming your health. I love cancer resistance. In that moment, you talk about exercise. Is it strenuous? Tell me about the exercise program.
Exercise has two components, and that plays into longevity as well. It's very clear from all the studies now that resistance training, meaning weightlifting, is an important component for a lot of different reasons. Number one, it can help treat type 2 diabetes. Number two, it builds stronger bones. It makes you resistant to falling. It just has a whole lot of benefits. And there's too much to go into here. But weightlifting is one thing. And then the energy that you have from aerobic exercise, walking is the best exercise. People don't have to go out and do a 5K run and try to get their time down on that. And as we age, the walking becomes better and better because it doesn't destroy our joints. It gives us the ability to go out and
So would you say
walk.
a healthy or a little weight resistance training? I've heard that your quads are actually the thing you should be working on for stabilization.
Absolutely.
But as men, we like to work on our arms, which right,
We can work on all of it.
yeah. So you can have a little bit of vanity and being smart about that. Is it possible that sometimes that the cure is just stillness?
Absolutely. There's the exercise and the movement, but also studies have actually shown that people who meditate on a daily basis
Mm-hmm.
become more resistant to diseases, particularly cancer, and that can be used to help in the treatment of cancer. And likewise, the component of spirituality, if there's that component of spirituality in your life, then people have been shown to live longer, even with a diagnosis of cancer, than people that don't have that. And also companionship, people that you can trust, that you rely on and have conversations with. That relationship is really key. So you mentioned the rest, but it goes along. All three of those things go together.
Yeah. And you know what? And I want to, because I always like to talk about marketing. The hardest thing to market is, so here's why doctors have to work really hard to become a doctor, but they don't need to spend a lot of money on marketing, is because when I'm in a car accident, I'm going to be immediately taken to the emergency room. It is matter of fact. If I'm a physician or a surgeon, I plant myself in one spot and surgeries come to me. In this case, right? People would ask me, well, I have a solution. How do I market it? My understanding of that would be, you have to be out there all the time. You have to be making 2 or 3 videos a day over and over again, because people are going to catch it at the right time. We talk about billboards, and many people have seen the attorney billboards,
Hmm.
right? And you say, hey, if you're injured, call us. If you're injured in a car accident, call us immediately. What people don't know, and what you should know, is if you're going to build a billboard, to put it on the exit that has the most accidents, right? That's where you put the billboard.
Sure.
That's the best form of marketing. In life with cancer, we don't know where it's going to show up, or when it's going to show up, or who it's going to show up on. So I can't build an avatar around a demographic. I can build a smaller avatar or a broader avatar. But what I would tell anybody who has a business like yours is, you need to be out there talking about it every day. You need to write the books. You have a book coming out. You've already started your second book. I love that.
And
You're at least 1 or 2 conferences a month. Speak often and record and share everything. That is the fastest path to interrupt the conversation that someone's going to have. If they're thinking about cancer, how are they going to resist it? Generally, I would say those people who are in the resistance mode have just seen cancer hit a bunch of friends and family.
absolutely.
I'm in that mode right now.
Yeah.
3 or 4 of my friends have cancer, very, very deep. They're very, very young. And I'm like, oh, I need to resist cancer. So this is, certainly serendipitous that we're here together. I love that providence. But
I do
tell me,
too.
what does we'll close it with this, Harry. What does the future look like? Are we going to get better as a culture? What can we do? What's the new interruption?
I think the newest interruption, if you're talking about from a medical standpoint, yes, I think we are going to get better. I think the old medical system is dying. I think more and more people are seeing that maybe the pharmaceutical industry doesn't have the primary interest of the patients at heart. They come up with new medications that can treat symptoms, but they don't treat the underlying disease process. Now, immunotherapy in cancer treatment may address some of that, but truthfully, there's a whole lot of health issues that we have not addressed properly as standard physicians in the Western sense that we are starting to learn more about now as allopathic physicians. For instance, under the new CDC guidelines, NIH guidelines, medical schools should be teaching nutrition courses, which they always should have been teaching nutrition
Sure.
courses. But I had maybe 1 hour in medical school.
1 hour.
1 hour. And medical schools are not much difference now.
Wow.
I
1
mean,
hour of nutrition.
and that's about what people get now. Maybe one course. There's very few medical schools so far that are addressing nutritional issues.
And in the 70s and 80s, they were like, oh, switch to margarine. get rid of butter.
Yeah,
right?
there's a whole lot
So,
of things that
it
we've done
depends
wrong.
on
Yeah,
what's the fad of nutrition in the moment that will even dissipate to the schools. So
that's right.
I think that's really, really, I think nutrition is the path. So here's what I want to make sure people, what's the website?
So sunrisehealthinstitute.com.
sunrisehealthinstitute.com. You can find Harry. I know that you have consultations, information, and people can download things on the sunrisehealthinstitute.com. Go there to the sunrisehealthinstitute.com. You can see it right across the screen. Go there, get information, share the information, find a way to get Harry's book. Make sure that cancer doesn't overtake you, that you are in a cancer resistance program. And if you need help designing your personal program, Harry's the guru.
Thank you for that.
And thank you for coming all the way out to Utah to share your story and your business. We're excited to have you.
Thank you for having me. I appreciate being here. I really do.
And I know you've already consulted with some of our Utah citizens, and
Yes.
you're making an impact with them immediately. So thank you so much, Harry.
My pleasure.
Yeah, this is the Utah Business Spotlight. I'm Peter Anthony. This is Dr. Harry Back, the Sunrise
Healthinstitute.com.
Healthinstitute.com. It's a mouthful, but it's important.